Hi everyone, thank you for joining us today for this webinar on understanding the connection between physical and mental health. I'm Elissa Makris, a business psychologist at Thrive, and today with me I have a guest speaker, Ian Prangley, who is the co-founder and health director of TrackActive. Hi Ian, how are you?
Hi Elissa, I'm good and thanks for having me.
Thanks for being here. So yeah, this webinar will start with a short session, a short presentation, which will be around 20 to 30 minutes, explaining the connection between physical and mental health and why it's important to understand it. I will then introduce Ian and ask him some questions on the topic, after which we will open up the discussion for a general Q&A with the audience. So please use the Q&A function or the chat function to ask any questions, and we will get to them at the end. And this webinar will last for approximately 1 hour and will be recorded and then uploaded to our YouTube page afterwards for those who weren't able to attend. So the topics we'll be covering are as follows. What is the whole person approach and why is it useful? The link between physical and mental health, why it is important to understand this link, and then there will be the short Q&A with Ian, where we will discuss chronic pain, physical exercise, and TrackActive. So before we talk about the connection between physical and mental health, it's good to understand what we actually mean with well-being. Well-being has been defined by the World Health Organization as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. What is key to this definition is that well-being includes a physical, a mental, and a social component. They are not mutually exclusive from one another, as they all play an important role in contributing to our resilience as well as happiness. Also, our well-being is not just the absence of disease or infirmity. We might be clinically healthy, however, we could be struggling financially, maybe socially or emotionally. Well-being is multidimensional and can only be fully understood and supported if we understand all the dimensions and individual differences are considered. We have to view the person as a whole, considering both their physical and their mental health as well as their social surroundings. So it is well known that an individual's emotional and mental state impacts their physical health and healing. At the same time, however, the emotional dimensions of physiological conditions are often overlooked. As researchers have observed, physical symptoms such as difficulty sleeping or lack of energy may be associated with mental health conditions. These could be signs or symptoms of a depressive disorder. In essence, there's no delineation between physical health and mental health. One cannot be separated from the other any more than one's leg or arm or heart or lungs can be independent from the rest of the body. So a more holistic approach is the biopsychosocial model, which takes into consideration the biological factors such as hormone levels, the psychological factors such as beliefs about ourselves and the world around us, as well as the social factors such as the environment and social support around us. By understanding how each of these components affect our well-being, we're able to have a more effective interventions and therapies, as well as increased awareness of individual differences. Just because two individuals might have the same condition does not mean that the same therapy or the same approach will be effective for both of them. When we're feeling stressed, there are different ways this can present for us. We can have emotional signs such as feeling depressed or being nervous, behavioral signs like biting our nails or eating unhealthy foods, as well as physical signs such as low energy or headaches. It could be just one of these or all of them. How stress presents is unique to the individual. So it is important not to overlook these physical components just because we believe that this might purely be psychological or vice versa. The placebo effect is another good example of how our mind can influence our body. The placebo effect is a phenomenon in which people experience a benefit after taking an inactive substance or treatment that looks like medicine but has no biological effect. Often this is in the form of a sugar pill. The reason why people may still experience benefits from this placebo could be down to their expectations. The more a person expects the treatment to work, the more likely they are to experience benefits from it. However, this is not the whole story, as when people receive a placebo, even knowing that it is a placebo, it still has measurable effects. So as I mentioned before, merely an individual's emotional or mental state impacts their healing. This has important implications for treatment of physical health conditions, specifically chronic conditions, as the patient's mindset plays a vital role in the effectiveness of the treatment they are receiving. So in essence, separating physical from mental health can result in less effective interventions and treatment. Stress levels present both biologically and mentally. They can be measured via self-report measures, which measure the psychological component, such as the perceived stress scale, or biologically via indicators of the autonomic nervous system. This is a system that automatically regulates things like our heart rate or our breathing, or the hypothalamic pituitary adrenal axis activity, which is a system of hormones that are linked to the stress response, such as adrenaline. I mean, I'm not going to go into detail explaining the intricacies of how these two work, as this might put you to sleep, but just know that they are key biological systems that influence our stress response. When we are in stressful situations, such as being late for an important meeting, physiological changes occur within our body. For example, our adrenaline and cortisol levels rise to prepare us for fight, flight, or freeze. If we experience this often, as is the case with chronic stress, our physiological reserves get drained, and this can lead to a number of health complications, such as reduced immunity, increased risk of heart disease, mental health conditions, poor sleep, and others. So there are two ways in which we respond to stressors. This can be through a bottom-up process. For example, when we swerve to avoid a car accident, this is an automatic response triggered by changes in the environment when confronted with external threats to keep us safe, or through top-down processes, which are more deliberate, that come from our conscious thought, such as worrying thoughts about the past or future events. So going back to the car accident example, luckily we have avoided the threat. However, now our thoughts about what could have gone wrong are being repeated in our heads. And so this is making us angry. So for example, we are angry at the other driver who made us swerve, or is keeping us from really reducing our stress levels and managing our fight or flight response in a better way. So this means that our heart rate will still be elevated and our breathing will continue to be shallow, even though we are safe now. And this is merely brought about by our own thoughts. So by having awareness of this, we can learn to cope better and bring our body back to baseline quicker. Learning skills such as cognitive behavioral therapy or relaxation exercises help us to understand how our thoughts, feelings, and behaviors interact with one another, and to bring about certain responses. We use these skills to bring ourselves back to a calmer state of mind and our body to come back to baseline or resting state, so that we can make better decisions for ourselves and manage stressful situations more effectively. So as mentioned earlier, by understanding how our mind and body respond to certain situations or stresses, we can learn how to cope better with these responses. For example, when having a panic attack, our heart rate might increase to a point where we believe that we will have a heart attack and that we might die. However, if we're able to manage our anxious thoughts, which trigger these physical symptoms, we are able to calm ourselves down, think more clearly, and bring our body back to a calm state, as mentioned before, this resting state. So with greater awareness of the mind-body connection, we're able to enhance our understanding of our own well-being. So taking the whole person approach also encourages the use of empathy as a tool to connect, build rapport, and ultimately empower individuals on a personal level rather than purely on a biological level. We can neither assign nor assume how a person feels. For example, when being diagnosed with a chronic condition, or the onset of severe illness or serious injury. Rather, empathy reminds us that a diagnosis or change in health status even one that does not appear to be serious in a clinical context, has the potential to trigger emotional and mental health changes in the individual. I'm going to recap all these points a little bit later on, but now I would like to introduce Ian to everyone, who is a specialist physiotherapist and strength conditioning coach. He has joined us today to give us some more insight on how looking after physical health and mental health go hand in hand. So, hi Ian, thank you for joining us. Would you like to tell us a little bit more about your background and your expertise?
Yeah, absolutely. And thanks again, Elissa, for inviting me on this webinar. I think it's a really fascinating area in terms of that crossover between physical and mental health. And certainly in my experience as a physiotherapist, I come across this daily. And yeah, just to give a bit of background, I graduated as a physiotherapist in the year 2000 in Australia. Prior to that, I gave a stint as a professional tennis player, and I'm also a tennis coach. I went on to study 2 further masters in sports physiotherapy and also exercise science, with a particular focus on strength and conditioning. So exercise is I guess I'm a subject matter expert in terms of physical exercise. I've worked within national health, private practice, and also elite sport. With the former, I worked at the Australian Institute of Sport as both a physio and a strength and conditioning coach. I was a head physiotherapist for the Australian Davis Cup team and Tennis Australia. And when I moved to live permanently in London, I worked one-on-one with Kyle Edmund, who is the British #2 tennis player. In more recent times, I've started up a company with a technologist, Michael, who's my co-founder, called TrackActive. And we are basically a company that provides digital solutions for musculoskeletal health.
Sounds very interesting. So you had have a lot of experience in this field, which is really good, because we'll need a lot of your input and expertise in this for sure. A question that I have for you in regards to chronic pain and mental health, because research has found that there's a link between chronic pain and mental health conditions. Can you tell us a bit more about this particular physical health complications and how they might be linked to mental health conditions?
Yeah, absolutely. And, you know, pain, if we just talk about pain, you know, acute and chronic pain, pain is basically an experience. I think amongst most people, we think of pain as being generated from, let's say if you've got a knee problem, there's a particular structure in my knee that is causing this pain, or within my back, the low back pain. Low back pain is the one of the highest causes of disability worldwide. And yes, I've seen it across all demographics in terms of how mental health, mental state of mind and pain interact. And I guess some of my first experiences was actually within tennis, and both as a player and as a physio in my early years. I would see that elite athletes, you know, prior to big competitions, certain athletes, there's obviously a lot of stress, there's a lot of anxiety surrounding, you know, if you're going on to play centre court at Wimbledon against Roger Federer or so forth, you know, that's a time that you often see players become more concerned about a particular pain in their body, and that pain experience can be heightened by things such as anxiety, fear, and so forth. So that's the experience. It happens in elite sport, and it's very common in other elite sports, speaking to other physiotherapists about it. In the clinical environment, and I've worked in both private practice and also the National Health Service. You know, it's very common day to day that you will see that, and chronic pain is a big issue for for our community, for businesses, with employees, and so forth. And just going back to what I was saying, you know, pain is an experience, and it's not necessarily just related to structural damage. And interestingly, they've done studies on looked at people with what we call non-specific low back pain. So low back pain that can't be attributed to, you know, a particular injury or a particular incident. And when they've looked at the MRI scans of people with back pain compared to people who don't have back pain, those scans look actually very similar in terms of the structural, you know, I guess structural integrity of the spine. And that in itself speaks volumes about pain being an experience that can be influenced by things that are going on in people's life in terms of their, you know, their mental state of mind, levels of anxiety. And being, you know, seeing a lot of patients over the years, you know, often you would potentially get someone who'd come back in and say, oh, their pain is worse. And you can't necessarily put a particular reason for it. They haven't done anything differently. But if you dig a little bit deeper, you know, there might be something going on in their life that they're not coping particularly well. And, you know, your body is their way of expressing it, feeling more pain. So there is that, you know, big crossover between, you know, pain, chronic pain and mental state of mind.
Yeah, that's very interesting. And it's also very interesting how you said in elite sports, when you're about to have a really important match, that you feel certain conditions even more that are heightened by your anxiety. That's very interesting. Usually there's also sports psychologists. Do they then help the individual to deal with these anxieties? Does it help them to manage these pains or these worries that they have a little bit better?
Yeah, I mean, it's a huge part of elite sport is having psychologists on board, and speaking from my own experience with individual players, having you know, a psychologist there is becoming more commonplace. Really, it's yeah, about giving them the coping strategies in order to, you know, optimize their performance. So I think that there's obviously a big place for that within sport.
Yeah, definitely. And also bringing it back to the point of, you know, when you said that the MRI scans of somebody who might have problems with their back, and that they would be the same of somebody who wouldn't be experiencing any pain. And if you dig deeper, you find that they might have other complications, maybe in their personal life or in their mental health. And that brings us also back to the point of empathy that we made before, when talking to the individual, seeing them as a whole person, and seeing individual differences, and showing empathy for their personal life as well, and not just looking at them as a biological creature, as a human biologically, but as a human as a whole, both mentally and physically. So that's very good point. It's very interesting.
Yes, definitely. It's when people come in to see me, it's okay, if they have a shoulder problem, I don't just look at their shoulder. It is about that person, both physically and also mentally, and getting to know them. And, you know, that's a big part of putting strategies in place to help them get better.
Yeah. So are there any case studies from patients maybe that you have looked after, which you would like to share with us?
Yeah, so there is one that particularly comes to mind, and it was a gentleman who was in his probably in his 40s, and he had a young family. He was a self-employed business owner. He owned a restaurant, and he had been struggling with shoulder problems for about 3 years, including having had a surgery, and you know, it was affecting his life, both in his sleep, but while he was working. And the pain had become more, in terms of when he was experiencing the pain, it wasn't just with a particular movement of his shoulder. You know, the pain was more constant, and, you know, and really was causing him a lot of, I guess, anxiety and stress about it. And you know, digging deeper, as we talked about, was sort of understanding his work-life balance and how that was going. And it was fairly obvious that he didn't really have that work-life balance, and he was working. I think anyone who knows someone who owns a restaurant, they often, and particularly, you know, on their own, running it, it's huge hours of work. And you know, uncovering that part of it in terms of his work and how much he was working, and what time he had to sort of wind down and relax, and anything else that he did with that. It was pretty obvious that wasn't, that wasn't present. And it was really, as opposed to, trying to, give him exercises to strengthen his shoulder. That was a part of it, obviously, in order to cope more. It was really about discussing around these aspects around his work-life balance and what he could do about it. And, in the end, eventually he decided that he really needed a change in terms of what he was doing with the restaurant, sold the restaurant, and, well, his shoulder became quite a lot better at that point. So it really demonstrated that he needed to change aspects around his life and how he was coping mentally that would help him to get better.
Yeah, that's an interesting case study, and it definitely also illustrates how it's not just the physical itself, but it's also the social and the work environment, even our working hours, maybe talking to our employees and employers, and to talk about flexible working hours, or to find a way to balance your life better so that you can also look after your physical health in a better way, I guess. So that's a really
and having said that, it's very common as well that you get people who are really struggling with a particular problem, and they're working very long hours at the time, and actually lawyers come to mind a lot, because they go through patches where they work a lot. Then they go on holidays, and they come back from holidays and see you, and their condition, their pain is much better. So it's just so important that we get that working environment right and that balance.
Yeah, that is true. Very interesting. So in terms of exercises, I know this is a very broad question, but is there exercises that are most popular? Are there any recommendations you can make maybe for specific pains or specific health conditions?
Yeah, I think just if I talk on a general, initially on a general perspective, for both physical and mental health, I always go with what Sport England and actually the World Health Organization, they correlate in terms of what they recommend we should be doing in terms of physical exercise. And that is 150 minutes of aerobic exercise per week, moderate intensity aerobic exercise, and 2 strength sessions per week. And I think both of those 2 different types of exercise are really important. So aerobic exercise, I think a lot of people for anxiety and depression has been shown to be, very helpful. And the same with, strength in terms of strength sessions, that does have very good mental health implications, I think, with depression particularly. But from a perspective of physical health, strength is really important in terms of keeping your body moving in terms of warding off joint pain, and aerobic exercise for more your metabolic health, you could say, is very important. And I think if we talk about the sort of employee work environment, mobility exercises and more frequent mobility exercises are important. So that could be 5 minutes, every hour or so, just step away from the desk and doing some basic mobility exercises, turning your head side to side, turning your trunk side to side, bending forward, taking your arm up above your head, just for, even if it's 3 to 5 minutes, that can be really helpful in terms of preventing conditions from happening and preventing conditions from becoming worse. So particularly in that office environment, neck and upper limb pain is a big one. And and also I thought I'd just go back to the strengthening exercises. Muscle strength is very much protective of joints. So those 2 strength sessions that we talked about, if you're looking to do that, it's doing sessions that cover all the major muscle groups of the body. So the hips, the knees, the trunk, and the upper body. Knee pain, for example, there's been actually quite a big correlation between strength around your gluteals and your hips in terms of preventing and managing knee pain. And, you know, around the shoulder, it's about having good strength around the shoulder blades and making sure that we're strengthening between your shoulder blades, as opposed to, you know, letting out. What happens when we sit at a desk all day is that our shoulders come forward and we can get tight through the front of the chest and weaker in the back, through the back muscles.
Yeah, those are some really good tips, and definitely some takeaway tips that we can like do right after this webinar as well, which is really good. And as you said, just doing 5 minutes every hour, it's the small things that really count and that make a difference. If you just make it into a habit and repeat it over time and make it part of your daily lives, basically. So talking about habits, how do you encourage patients to make looking after their physical and mental health a habit?
Yeah, the first and foremost, it's about education. If we're going to do something and make it a habit, we want to know it's going to work. It's going to be good for us. So that's the first thing I do with patients. If I tell them to do specific exercise for general health or for their condition, I really try and give them the evidence behind it in terms of why, the rationale behind it. Because once you believe that it's going to help, then you will, you know, that's your first step in terms of making a habit. Otherwise, it's really hard to get off the mark there. The second thing, and just sort of talking about, you know, timeframes, it's really about being realistic of what you can fit into the day. So if we set ourselves very lofty goals, you know, I'm going to, you know, run for an hour 5 times a week and do 4 strength sessions a week, but you don't have the time to do that, to fit it in, then eventually that's just going to fall apart in terms of, you know, you're not going to be able to create that habit. So, you know, smaller duration sessions, being realistic about what the person can do that fits into their day is really important. And then the third thing that's important is providing feedback to them about how they're going. So once they're getting started, you know, let's have a little look at what you've been able to do, where you've been and where you've got to, and then that reinforces them to stick with it and to continue on, you know, with that.
Yeah, interesting. So yeah, it's about education, it's about realistic goals, and it's about reinforcement of positive process that has been made, which creates those habits for people. Just to summarize your points, and I think those are really important takeaway points that we can all take away after this for creating physical health and taking care of our physical and mental health as part of our habits. Just to keep going back to those 3 points of educating ourselves, looking at webinars, listening to people or reading books, then setting those realistic goals for ourselves, and making sure we celebrate those small goals that we set for ourselves, and then looking back at the process that we've made regularly. Maybe how regularly would you look back at the process? Would you do it like once a week or twice a week or once a month?
Yeah, I basically any contact time, as me as a practitioner, any contact time that I have with someone is an opportunity to provide them feedback with how they're tracking. So it's really an ongoing process, and I think having that feedback accessible to them when they want as well is important.
Yeah, makes sense. So can you now tell us a little bit more about TrackActive itself, and what is it about, and what was your motivation behind developing it?
Yeah, so TrackActive, so it was 7 years ago that we started the business, and initially, as a physiotherapist, I saw, you know, there was a real problem in terms of people adhering to exercises, similar to what we were talking about in terms of creating a habit and, you know, about doing their exercise. And I think the statistics show that less than 50% of people do their exercises as prescribed by their physio, and basically not getting the outcomes that I think we should be getting when we're dealing with patients, rehabilitating them. So we commenced the business. We started an exercise prescription software where physios could prescribe exercises to patients. They would receive their exercises on an application, and they could feed back to their practitioner in terms of how they're tracking. So the exercises were all there with videos and so forth on their application. So it was on the mobile phone. They didn't lose sheets of paper and so forth. And we started that, and we started selling that software to clinics. And I think we saw a bigger opportunity as we went along in terms of, you know, what technology can do and what, you know, artificial intelligence can do, and data. And there was also, you know, a big push around people really self-managing and looking after themselves in terms of their physical health. So we developed our new product, which is TrackActive Me, and it's really focused on the corporate and the corporate employee section in terms of looking after employees and their musculoskeletal health. So it's a self-care application where people can go into the application. They can assess their physical health, assess any physical complaints via a chatbot, and based on those clinical algorithms, develop exercise programs for them to follow on the application, with a real focus to both, you know, manage existing conditions and prevent conditions from occurring in the first place. So the application contains programs such as what we call our Office 5 exercises. So where people will get reminded to, you know, step away from their desk for 5 minutes and go through those mobility exercises that we mentioned. And so, yeah, it also tracks things such as, you know, aerobic exercise and strength exercise. So it's a really sort of, I guess, a holistic sort of app in terms of that physical health component.
Yeah, that's very good, because now the focus for both physical and mental health has shifted more from therapies once the condition has worsened to preventative methods, to help people to feel more self-empowered, to manage their concerns or pains that they might have before it even gets to a point where they might need medical intervention. Yeah,
absolutely. It's, you know, I think one of the biggest issues we have is delayed intervention of, you know, traditional health services. So, sometimes it involves, you know, going to the doctor, getting referred, speaking to their insurance company. And by the time they see someone, it can be, you know, a few weeks down the track where their condition has worsened. But if we can get to someone with digital products that helps them, you know, gives them intervention straight away, you know, you can nip those conditions in the bud. And we know a lot of people, for example, back pain, you know, once you've had back pain, you know, you're much higher likelihood of having recurrences too. So that's where that preventative aspect comes in, where people can follow programs to really make sure that it doesn't happen again.
Yes, absolutely. It's definitely extremely helpful for people, and something that we would encourage people to also take active action in, to make sure that they are proactive about, even if they feel fine, if they say, I'm okay, like I don't have any problems, to look into this, to find ways to keep active, to find ways to strengthen their muscles. As you said, strengthening our muscles is really helpful in preventing any sort of injuries from happening as well. And even strengthening our muscles doesn't mean that we need to go to the gym and lift really heavy weights. Becoming creative with that as well, because body exercises is something that can strengthen your muscles as well without having to lift anything really.
Yeah, that's it. And I think that people view strengthening exercises as, well, I need to join a gym. And well, in the current environment, it's not particularly attractive necessarily to go to a gym right now. And so there are, and that was the premise around within TrackActive. All the exercises that we put in were, you know, exercises that people can do within their own home with minimal equipment. So, you know, they can follow that without having to go to the gym. And yeah, as you said, it's about being creative with those exercises to do that.
Yeah, definitely. So yeah, thank you, Ian. I'm going to open up the floor now to questions from the audience. So please use the chat function or the Q&A box to ask any questions to both Ian and I, and we will get to them now. So let me just check. There's some comments in the chat function.
Yeah.
In terms of exercise, how much walking is recommended?
Yeah, so the guidelines is we should be trying to get to 10,000 steps per day. It was actually, we also implemented that within TrackActive Me as well, so people can, if they're walking with their phone, that those step counts can come into the application, so they can check the app to see how many steps they've done. So that's the general guidelines. I suppose though, if you're if you're doing other things like cycling and swimming, it's not always necessary to, oh, I've got to get those 10,000 steps, but it is a good benchmark to try and reach.
Yeah. I have always been a keen swimmer, and it calms me a great deal. I seriously miss it currently due to the lockdown restrictions, as my local pool isn't opening currently. So I keep busy all week with Pilates, aerobic, and body conditioning classes. What are your thoughts on wild swimming, though, as a pool alternative to swimming? That is meant in terms of well-being.
Yeah. Okay. So wild swimming, is swimming in the ocean, or is it I'm just trying to, it's the first time I've heard that terminology.
Yeah, me too, actually.
Yeah, I mean, if it's, swimming, if it's swimming in a pool or if it's swimming outdoors, obviously just make sure you're safe if it is sort of more ocean-based swimming. Swimming is I'll talk about swimming in general, and swimming is a great exercise for people who do have joint problems because it is low impact. So particularly knees, knees are a great one where people can go in, if they're a good swimmer, it really helps them get that aerobic exercise that they need. So, running is not for everyone and not for every knee. And I've just got, I see.
Yeah.
People go swimming in marine lakes.
Marine lakes. Yeah.
I mean, outdoor swimming, if it's safe, I think it's fantastic. And I probably, Elissa, you'd probably agree that swimming outdoors in the wild is much better than in terms from a mental perspective. I'm sure it's probably a bit more calming than indoor swimming too.
Oh yeah, definitely. You can use it as a type of meditation as well when you go swimming or even running outside in the park, or whenever you're outside and you do your exercise, but you're also paying attention to your surroundings, so to the nature. You have some sort of appreciation of nature, and this is a type of meditation in itself, which can really help you both mentally and physically at the same time.
Yeah, absolutely.
Does it surprise you that elite sports teams still don't employ sports psychologists, or perhaps don't see the need for them? They all spend a lot of money on nutrition, but some overlook the benefits of sports psychology.
Yeah, I think I would agree that there's probably still a number of sports that actually, Elissa, did you want to answer this, or do you want me to answer this? I didn't know who this was intended for.
I'm happy for you to give it a go, and then
and you can add to it. Yeah, look, I think there's still, I guess, a bit of skepticism in some sports. So from a tennis perspective, speaking to coaches, and particularly coaches who were around before really sports psychology has grown, probably feel that it's not necessary, or maybe it's going to have a detrimental effect. But I think a lot of that, that is changing. It is becoming more commonplace. One of the challenges I probably found in terms of sports psychology in the environment I'm in with professional tennis is that a lot of players don't necessarily have the at the very top level, they have the funds to be able to fund a sports psychologist, but at the lower level it's often difficult for them to be able to justify that. And I think one of the important parts is, if you do get a sports psychologist on board, it's really important that they do see the athlete in the environment that they're competing before competition, to understand that and be able to implement those strategies that is needed. So, I think in a lot of respects, some of the some of the sports teams might, you know, be doing a little bit of cost cutting in regards to that. Well, the individual tennis players, you know, often put that at the lower level, but you know, for some players, it's essential and it can make a massive difference.
Yeah, definitely. And as we mentioned before, being educated also about the connection between mental health and physical health helps a lot to raise awareness of this. And maybe it would be something that will become more popular in the future as well. It's the same with occupational psychology as well, since I'm a business psychologist, and it's also quite a new field. Organizations used to not believe that workplaces needed work psychologists, but this is a new field that's developing and is becoming more popular, and is being recognized that stress within work and using those preventative strategies that Ian was talking about before, both from a mental perspective but also from a physical perspective, is really important. And I think that comes around the point of educating and doing these webinars and talking about it openly and having discussions about it.
Yeah, and I'd also add to that, Elissa, what I saw on the professional tennis circuit, and I was on there for, well, traveling with players for about 15 years, is that when I first started, it was fairly rare that a player would have their own individual physio. But then more recently, you know, it became a lot of players were getting individual physios to travel with them. And I think the same is sort of happening with psychology as well.
Yeah. I've been doing a lot of yoga at home since lockdown. My partner says that the amount I do, 2 hours most day, could be too much. Is there a risk of overstretching, etc., with these types of exercises?
Yeah, I love this question. It's a really good question. I think you'd probably get a few split views amongst the physio community. I think, first of all, there's, from a mental health perspective, I know that a lot of people, you know, really benefit from yoga in terms of that side of things. And I think it's a very calming, calming form of exercise. It also helps to stretch out a lot of the neural structures, which I actually feel, you know, has a lot of benefit in that regards as well. In terms of, can you do too much? I think it depends on the type of exercise and also each individual person. You know, if for example, if I have someone who comes in and they've got a very hypermobile shoulder, which means they've got excessive mobility in their shoulder, and they have pain or some problems or feelings of instability with that, then I would be inclined to say, look, I know you like your yoga, but we probably just need to modify some of these exercises, because we don't want you, you know, getting worse in terms of, you know, encouraging that hypermobility, and you actually need more stability around your shoulder. You need more strength around your shoulder. And I know yoga, you know, certain forms of yoga do help in terms of that strength, but they might need more specific strengthening. So it's really horses for courses with yoga. It really depends if you've been doing it for a long time. So you've been doing it since lockdown, and if you haven't experienced, you know, any discomforts that you can relate to yoga, then continue. You know, continue with it. But if you are starting to feel certain problems in certain areas, then you might want to get that checked out and just sort of see if you should modify your yoga. But if you're enjoying it, it's keep with it, but you might just need to do some modification if you are getting you know, any issues from it. Yeah,
absolutely. It's about really having that self-awareness, I guess, of your own body, and being aware of when you reach your limits, and if you are over, if it's too strenuous for your body, then maybe slow down a bit. But if you feel good about it, if your body feels good about it, if you feel mentally good about it as well, then there's no reason to really stop. And I myself, I'm a big yogi, so I love my yoga as well. And 2 hours, so the normal yoga session is around 1.5 hours to 2 hours.
Yeah.
It really depends on the type of yoga. So let's say a 1.5 hour yoga session consists of strengthening for half an hour, meditation for half an hour, and stretching for half an hour. So it's really a mix of the three. So maybe having this awareness of those 2 hour yoga sessions, what they contribute of, Because if it's 2 hours of only strength or 2 hours of only stretching, then the balance might not be so right in those sessions. But if there's a good balance, then there shouldn't be any problems.
Yeah, I was going to say the same thing, Elissa. Like the strength side of things is really important. So, you know, making sure that that part of it is, you know, addressed, or you're doing that kind of thing within yoga, and making sure that that strength is across different areas of the body. So I would say one thing around a lot of body weight exercises is that sometimes people, you know, do, I've seen this before, where they do a lot of strength work around the chest area, and they become, they build a lot of strength here, but they don't, it's very hard at home to do more strength-based exercises around your back. So that's something to take in consideration, particularly when we're talking about shoulders and so forth, and making sure we're doing exercises that also strengthen our back.
Yeah, absolutely. When you're suffering from mental health, finding the motivation to exercise is often very difficult. Do you have any advice? Would you like to give it a go, or should I?
Elissa, I think you start, and then I can add my two bobs.
Yeah. So I just want to put a little disclaimer here that I'm not going to be able to give individual advice to you, because I don't know you as a person individually, or what mental health condition you are talking about specifically here at this point. Finding motivation to exercise is in itself very difficult, even for those individuals who, let's say, do not have a mental health condition. But I can believe that having already this mental health condition can make it even more difficult to find maybe a schedule or time or the motivation to do a lot of things. So my advice is that you incorporate both taking care of your mental health and physical health into one. So making sure that, let's say, if you want to meditate when you look after your mental health, or if you want to do some relaxation exercises to look after your mental health, or some therapy, you can do that while, let's say, going on a walk outside. So you can incorporate the two together. So you can listen to a meditation, put on some relaxing music, do some breathing exercises while you go on a walk outside, or, as we said before, even swimming. So the low impact exercises can be easily incorporated within taking care of your mental health as well. So the motivation behind it would be to find this habit that we were talking about before, to find reasons why you want to do things, to find the motivation is to be able to understand how that will impact you in the future. So you have certain goals, those realistic goals that you set for yourself. And we said those 3 steps before. So you educate yourself about, let's say, your own mental health condition. You educate yourself about physical health as well. Then you find those goals that you want to set yourself, those realistic goals, maybe short-term goals for the next 1 or 2 weeks that you will monitor. And then you will go back in time and see what has changed for you in these couple of weeks. So maybe you do some journaling, or you make sure that you use, as we said, one of these apps like TrackActive or even Thrive app to track your mood, to track your exercise, to make sure that you yourself know the results. And this will keep you then motivated to keep going and make it a habit in the future. Ian, do you have anything to add?
I think that's a great answer, Elissa, and a very good question too. But what you said completely resonates with me in terms of how you would approach that.
Yeah. All right, so I think that was all the questions for today. There don't seem to be any more. Thank you so much for signing in for this webinar, and thank you, Ian, for your contribution. It was really useful to hear some expert insight on this, and a case study and all of that. It really made it relatable to us as well. So thank you for being here.
Thanks a lot, Elissa. I really enjoyed it, and yeah, it's great that we're talking about that link between physical and mental health, because treating them as silos is not always the best way.
Yeah. All right. Thank you, everyone. Bye.
Thank you.